This is primary and secondary. So, however, a last normal ovarian function before age 40, we consider as POF. So, premature ovarian failure. And the epidemiology part, we say at least 1% of women under age 40 affected by POF. 0.1% of the women under age 30, and 0.01% age of women under 20 all got affected by POF. POF is not early menopause. So they say, oh, it's just symptoms like menopause, but the POF is not early menopause. POF is the menopause is unreversible. It's a natural degeneration to women getting older. So, and POF is like a temporarily ovary shutdown, so we can cessation of the ovary function. So many times it is reversible, so they still be able to have a baby. And according to age, a group, according to the time, treatment, so take care, so on. And treatment, so Western medicine mostly just try to hormone therapy, and also IVF part, just like IVF with the egg donation or adoption. That is pretty much option for Western medicine view. But today, so we are acupuncturists, we are TCM practitioners, so we have a good way to offer. And even in Western medicine, this condition is pretty tough to treat it. So we can really try from our will to helping to regulating the hypothalamus, pituitary gland, ovary axis to recharge, almost like reset up the axis function properly again. So we be able to have some good results. And also lately, China have lots of research come up. So they did show, the research paper did show, along with Chinese medicine, herbal tea, or acupuncture, need a little bit more time, they do have very good outcome. But if you combine with the Western medicine, like hormone therapy, but it must be lower dose hormone therapy. It's not like menopause hormone therapy. Menopause hormone therapy is a different dosage, and the POF dosage is different. So the combination and both method together is more phenomenal. So like outcome is the best. So we're talking a little bit about the cost. The cost really is divided to main POF happen is genetic. We say genetic just like include, normally it's a chromosome issue cost. The family history, possible 20 to 30% of people have this genetic, the condition. And mostly happen at age 35 or before 85 or 40. So, and sometimes it occurred even younger. And include 4 things. Number 1 is the mosaic Turner syndrome. Number 2 is the steroids enzyme and defect. Number 3 is the ovarian reserve function resistance syndrome. Number 4 is the ovarian dysgenesis. I forgot the Turner thing. Okay. So mainly we think this is genetic. It's also like we consider as like a primary cause. So genetic thing, they born that way. You know, secondary is we think it's like a down the road, down the line. So somehow to happen. So number 1 is toxic. So toxicity, so include the chemotherapy, radiation therapy, and also they can damage the ovarian cell to help the cell the function depletion. And also other toxicity such as a cigarette smoker, and also chemicals, and also pesticides. And the virus might also can cause this ovarian failure issue. off and on, we're talking about autoimmune condition. Autoimmune conditions, so mainly is caused by multiple life surgery. So Ovarian surgery, also abdominal surgery, multiple surgery, or virus infection, so mumps, lupus, or to cause the immune link, to cause the ovaries to have an antibody to their woman's own ovarian tissue, you know, so can cause the antibody. But the happen, why is POF happen, really unclear, called path. And the complications, so like a complication just because the POF is a really premature ovarian defect, so off and on just no menstrual cycle. So amenorrhea and the irregular menstrual cycle. Irregular menstrual cycle. Wow, it's like it's scary. So and also infertility, osteoporosis, depression, and then insomnia and anxiety, and the increase of risk of the heart issue, disease, and the dementia, and the later on life. Those kind of conditions is really because estrogen level low, so high FSH. So almost your body never got nourished. So those complications. Diagnosis is pretty easier, you know. So number one is clinical symptoms. So like I was talking about it. So irregular cycle or absent menarche or secondary amenorrhea. Number two, and because of low estrogen, high FSH cause the symptoms like hot flashes, night sweats, and heart palpitation, and depression, insomnia, vaginal dryness. It's clinical symptoms. Then we go down just like everybody else for infertility treatment. So we do the test. So main test is FSH and LH search. So and the diagnosis for POF really have to be related with high FSH. But we do take the 4 weeks apart, consecutive 2 times. If you diagnose more than 40, FSH more than 40 consecutively, and we pretty much can diagnose for, but some book even consider 30. So, but however, you have to be type consecutively 4 weeks apart, 2 times test. And they can, if you have that test done, so we pretty much can diagnose with the clinical symptoms as well too. And the LH also often on elevated. And also we're talking estradiol. Estradiol, because estradiol, ovary function depletion, so we don't have many follicles. Of course, estrogen kind of low, you know, most of these times lower be 40s, below 30s, is often can see that. And next is the plaque level test. Plaque level test, as everybody knows, so they can cause the low, high, mainly high can cause amenorrhea happen and cause infertility. But they different than POF. We must be differentiation of with the POF condition. And TSH. TSH is free T3, free T4, and TPO test. So, and because the POF patient, it is also immune link. And Hashimoto condition, it is often on, can see in the POF case. But as the TSH hyperthyroidism and affecting infertility is not necessary only must be the POF, but definitely in many conditions of the infertility you can see hypo can cause the infertility happen, you know. And the other test is just AMH, so we didn't test. But the AMH, like Dr. Mars don't like to do that, but lots of studies, so we still is the way to observation, the ovary follicle stimulation, the follicle anti-Müllerian hormones, so to try to observe the ovarian reserve function. So POF, of course, reserve function very low, so this must be tied together. And also autoimmune antibody test. But even we think we have like an anti-Ovarian antibody link to cause the POF, but the test is not necessarily always show positive. So we don't go that for use it. Very important test is the karyotype test. And the karyotype test, just try, usually this condition caused by chromosome issue. So we use the karyotype test and also FMR1 gene test associated with the Fragile X. So this kind of thing. So if it's really in the menarche time, so absent the menstrual cycle, we should early on to do the test to understand its genetic cost. So that's diagnosis, not difficult, very easy. Main is like symptoms, clinical symptoms. Second is a high elevated FSH and LH. So pretty much we can diagnose this for POF. Diagnosis is easy, but treatment is difficult because, so like no